my name is Carson, and I'm going to be the nurse taking care of you today. I wanted to briefly go over the Mohs surgery with you, just to make sure that you were comfortable, and also if you had any questions about the surgery or any concerns, we can go ahead and address it before your procedure. So to start, the Mohs surgery is a type of procedure to treat skin cancer. It's commonly used to remove basal cell carcinomas and also squamous cell carcinomas. Today we are going to be removing the basal cell carcinoma from the middle of your zygomatic bone or cheekbone on the left side of your face. The basal cell carcinoma begins as a basal cell on the base of the skin, which grows slowly and is also relatively simple to remove as well. So the first step is the examination of the skin cancer. Since it is on your face, we are going to have to place a drape over your face just to ensure that sterile field. However, the dermatologist will walk you through the procedure step by step, and you will be awake for the procedure as well, in case if you need to get the attention of the dermatologist at all. So the first step is going to be the biopsy, which is going to be taken off of the superficial layer of the cancerous skin, which is going to be that outwardmost skin section. This will expose the rest of the cancer to the surgeon, where they will be able to view the deep edges of the cancer. This step will most likely be done using a dermatome or a knife to cut the skin. So after they take that initial biopsy, they're going to send it to the lab, where they're going to view all edges of the specimen in order to make sure that the next cut that they make is accurate. And they'll keep doing this until all of the cancerous tissues are gone. So finally, wrapping up with the surgery, depending on how much skin is removed from your cheek, it is possible that we might have to complete a dermatoautoplasty, which is basically where they take a skin graft from your own skin, probably from an area that has soft tissues, such as your gluteus maximus, or your back, or an area of your body that no one would ever really see, just to ensure that soft tissue is replicated on your face. But yeah, it will just help provide a little bit of extra surface area for the repair as well. The surgery itself could take a few hours to complete, just to ensure the complete removal of the cancer without removing any of that healthy surrounding tissue. So lastly is the aftercare, which is just as important as the surgery itself. So making sure, to keep it clean after the surgery itself. It might lead to a suture, which is just going to be combining the skin. But basically afterwards, it is completely normal to have bruising or a contusion around the area of the surgery. So we just want to make sure that you're reducing your physical activity, trying not to directly submerge the wound in water, and also just being really gentle around the area, cleaning it. Just trying to avoid, putting makeup on it or anything like that. Just really just trying to let it heal. And then the facility will follow up with you after the first week to ensure proper healing of your suture, and then again 2 weeks later. Then after that, we recommend following up with your dermatologist. I don't know if you have another preferred dermatologist or if you would rather just come back here as well. Every 6 months. So if you notice any signs or symptoms, call the facility right away. That way we can schedule you an appointment. And if you notice any new or developing skincare growths, definitely let the facility know. That way we can go ahead and get it taken care of. But I just wanted to know if you had any questions.